Shall we have a small case study discussion regarding what are the sensors used in the wearable device and what the specific applications used for?
Yes,
Okay? Fine. Can I start?
I'm starting this.
Okay.
First of all, I'm introducing myself. I'm Dhanidharan from third year biomedical engineering. And as you said, we are going to talk about sensors, especially on biomedical or our branch. So basically, what is the concept is they choose two things in process. First one is non-invasive, and second one is very lightly invasive. Because the sensors which are on the surface of our skin, of our body, is totally okay for people to wear. It is not causing pain, not causing infection, or not having any other problems. We can go and come anywhere. And to be honest, the two types are very important in it. The first one is physical monitoring, and the second one is activity monitoring. The physical monitoring will come under physical sensor. The activity monitoring come under chemical sensors. Physical sensors usually notes our run time, how many steps we walk, where we go, like that, the basic hand watch concept. But the biochemical sensor is little different. It is used for like diagnostic purposes, like using our sweat. It says what are all the things we have, skin resistance, and also sugar levels they are developing for it, and it goes on. So these are all the basic things in biomedical industry, and especially these are all called as non-visible sensors, because these sensors will not in a big size. This will be in very small size, and we can't see where it is. It will be inside our eye. Tattoos are they are tattooing it. They are doing it in lens, and they are doing it for lasers and etc. So. Okay, start.
Okay, I like to raise the point. First of all, I introduce myself. I am Raghunath from third year biomedical engineering. Now I am going to say about the HR sensor, the heart rate sensor, that used to detect the heart rate, whether the heart rate is normal or abnormal for the people or patients. And this mostly used in sports sites, because the daily rotate is running, working, so the heart rate will be increased. So the sensor will detect, and the sensor will give warning to the person who have heart rate will be increased. This used in also hospitals to the patient. When the patient will be get sweating or heart pain, it will be detected, and the heart rate sensor will be give to the patient whether the heart rate will be normal or abnormal.
Okay. Next, can anybody tell me?
So hi guys, I'm Narisha from third year biomedical engineering. I'm going to speak about the technical challenges while building and while using sensor. Basically, variabilization main issue for while building a sensor, because I'm wearing a watch for quite more than 2 to 3 years. I do not have a feel that I have been wearing a watch. It's like a part of my body. So in the same sense like that, when we are innovating a wearable device, it need to be all like a part of our body, not just a thing. Another main technical challenge is power and battery life. Because the sensor is so small, it need to be work for longer periods. It's not shorter time. Even though its size is small, its power need to be high, and data privacy and artifacts. If loose contact or non-contact skin or poor movements can give noise in the signal. It's like false readings like that. So thank you.
So hello all, I'm Gopika from third year BME. I would like to say about future scope of wearable devices, because when innovation has started growing, people are moving to the wearable device, like monitoring for tracking those things also. And in basically healthcare, we are using a wearable device mostly to check the activities of patients with coma, and where the unconscious stage, we are tracking the patient, their heart rate, pulse rate, and those things also. And it also used to early detection of disease diagnosis and it also used in all the fields like industry works and healthcare monitoring, fitness and sports for all. And in wearable device, it is most rapidly growing thing.
Okay, now we all came to know what are the sensors we have used. As Dhanidharan told, we have active sensor and then passive sensor, right? Then also we spoke about the chemical sensors. Okay, the chemical sensor which is incorporated in our body. Okay, it can be invisible. Likewise, Ragnar told about the heart rate sensors, which is used to measure the heart rate. And we also told about the physical activity monitoring of a sports person. Like by using these heart rate sensor and an SpO2 sensors, we'll be able to identify the vital parameters of a patient. Okay, these hope we all came to know what are the sensors we are using in the wearable device, and hopefully this technology will be developing to another stage also. Thank you for the question.
Thank you.